Well, I'm extremely excited. I think this is going to be one of the main reasons why this program will be successful is the inclusion of chronic pain with the 11th indication. Up to now, we had a limited amount of patients who come to us. But with this indication, I would expect at least 8-fold increase in amount of patients coming to our institute.
Now, when's it go into effect? Immediately, or how does it work?
Well, I just did discuss the issue with the commissioner, and apparently it takes 45 days for it to be written, and there'll be a 45-day period of time where there will be discussion. But it looks like it's going to be early 2017, so I would recommend that our pain patients contact us now, but we'll have to wait to early January of next year. Mainstay in the treatment of pain has been always opioids or narcotics. Unfortunately, it has a long list of complications. And in all fairness, for benign pain, there is not a strong reason to use opiates on a long term because there's too many complications, and not to mention the addiction potential. So medical marijuana has been looked at for not years, but thousands of years as a treatment for chronic pain. And we know that medical marijuana will decrease the severity of pain. There have been studies done. So we know it works. Although it may not take the place of all the opiates in your system, there may be a significant decrease. The states that have approved medical marijuana so far has shown a 25% decrease in the death rates from opiate overdose. That was recently published. So we know that by using medical marijuana, the amount of opiates will decrease. And just to remind everyone, there's 19,000 people in this country die from opiate overdose. So it's a real epidemic in this country. So the need for medical marijuana is real, and it's going to help our patient population. And at the end of the day, it's about quality of life, isn't it?
What is chronic pain as far as what would qualify for medical marijuana? Do we know at this point?
We have not seen the definition from Albany or New York State Department of Health. Chronic pain is usually defined of pain in any part of the body that is there more than 15 days a month. That's the definition of chronic pain. It doesn't have to be every day, but if it's there half the time, we usually define it as chronic. Chronic pain is incurred by 100 million people in this country. So 1/3 of the population in this country have chronic pain of some sort. So it's a real problem. Up to now, it's cost the country $600 billion a year. So chronic pain patients are out there. The question is which patients will respond to treatment, and some of that will be the clinical experience that we'll have going forward. Some of that will be unequivocally researched, which right now has been unfortunately suppressed because it's still federally illegal. And for physicians to conduct research, it's very difficult because you jeopardize your medical license.
You know, and that brings up a good question. I actually talked to a chronic pain patient this morning who used to be one of Dr. Gossi's patients, and I asked her, I said, well, what do you think about this? Would you consider medical marijuana? And she said, oh no, not at all. I don't want the stigma, it's a legal drug. So how do you overcome that, you know, with patients out there who might be suffering but afraid to even consider this because of the stigma?
The stigma is there because of lack of research. In 1970, Nixon passed a law that placed medical marijuana as a Schedule I drug. Just to remind you, Schedule I drugs are heroin, LSD, ecstasy, peyote, and medical marijuana. And the definition of Schedule I, it has no medical need and it's highly addictive, both of which are not true about medical marijuana. So I would say to these individuals, they have to open up their minds, research it, and I will say that Albany and Washington needs to allow the physicians to do research. Because once we do the research and prove it, that medical marijuana will be an accepted form of treatment by everyone. For example, 71% of physicians in the United States approve of medical marijuana, 71. And 51% of the nation's population approves of medical marijuana. So it's changed over the years. That stigma that we had years ago is not really there today, and proof of that is the states are approving it one by one. Just recently, we had 5 more states approve medical marijuana. Half of the states in the United States have approved medical marijuana for the treatment of various neurological and chronic pain syndromes.
That's interesting. With all this new demand that you expect to come in for it, will we be able to meet the request for all this demand?
Good question, and the answer is probably not. So this allows these registered organizations, these companies that have come to New York State, and so far we have 5 companies with 4 dispensaries, to be successful, because their fiscal health is important for us to send patients to their dispensaries. So far, of these 5 companies, we've had issues. Some have even lost a significant amount of money, and some are just breaking even. And for that reason, when I send a patient to a dispensary, they only have 1 or 2 options for my patients, not enough. I have a lot of patients who drive to Rochester or Syracuse to pick up the formation of drug that I have recommended. And let me just remind everyone that we're not talking about smoking, and we're not talking about edibles. We're talking about vaporizers, tinctures, and capsules. That's what's been approved in New York State, and that's what we have to work with.
So going forward, are we going to need more dispensaries and more growers? I mean, how do you think it's going to be solved at this point?
These are called registered organizations. We need more. We need more dispensaries that go to the southern tier and other parts of New York State where patients have to drive over an hour to one way just to find one. We need them to be open up 5 days a week, and we need to have the shelves full of options that the physicians and nurse practitioners can work with.
I understand there's been a development with nurse practitioners too. Explain what's happened and how could that help your patients?
One of the criticisms of the program is I can't find a doctor. Although there's over 700 doctors who've been registered, most of them don't put their names out on a website and don't acknowledge that they are certified. We here at the Institute have 9 physicians who are certified, and our names are out there. Because of this, patients have a difficult time finding the right physician. So this is exciting, and nurse practitioners are able to come in, work with a physician group, and see these patient populations. If chronic pain is a new indication, and apparently this is the case, then the floodgates are going to open. We will be receiving right now 50 phone calls a day. I would expect that to increase 5-fold. And we need to be able to see these patients. So with nurse practitioners, and in 45 days from now, possibly PAs, we may be able to serve that population appropriately.
Can nurse practitioners prescribe it right now, or do
they can prescribe it if they take the examination, which is a examination that the New York State Health Department has put out. And when they pass, then they get registered, and then they could certify patients.
Okay, and the PAs, they have to wait until January?
The PAs are now in a period of time when the legislation has requested that the PAs be considered. There's a 45-day period of time for comments, and after 45 days, in my opinion, PAs will be allowed to certify patients for medical marijuana.